So the next thing we'll do is we'll mark out all of our landmarks. The first thing I like to mark out is the area right behind the clavicle and the acromion. There's a lateral aspect of the acromion, clavicle, the acromioclavicular joint, feel for the coracoid, and then I feel for the humeral head. And that will change with every patient based on size and shape. So it's important to learn not only the reference point of where the posterior lateral corner of the acromion is, but also where the equator of the humeral head resides. I typically line up the lateral portal in its mid portion and possibly slightly anterior to that, just at the back edge of the distal clavicle as it runs laterally. And then the anterior rotator interval portal is somewhere in there, but will be localized using an arthroscopic needle and an outside-in approach. We'll make our posterior portal first, just through the skin. And then I'll go in with a 4.5 millimeter cannula because I use the bridge. And once I go in, sometimes you'll actually hear the sound of a vacuum or a suction. And that just means that you've hit that negative pressured joint space. Now I'm going in with a 5.5 over a switching stick to provide better inflow and improve my visualization. So here we're looking in the joint, and the first thing I like to do is identify the biceps tendon, the superior labrum, and establish my anterior rotator interval cannula. So I'll bring this localizing needle in, and you may make minor adjustments to your rotator interval anterior cannula based on what you're trying to accomplish during your case. Obviously, if you're trying to do a bank art, this would be more inferior and possibly more medial. If you're trying to do a biceps tendon, it may be more superiorly placed or more centrally located. So it depends on the different procedures that you're performing. But in general, you want to localize this and be roughly in the center, halfway between biceps and the subscapularis, over the top of the labrum. And then we'll go ahead and make a insert. This is a 5.0 cannula. And then we'll start to improve our visualization and debride a bit to clear up the visualization.